Hi everybody. So I figured this week we would talk about knees because there's so many knee injuries that are happening all the time, whether you're an athlete or you're just a mom and a dad. People are getting ACL tears, some PCL tears, and then there's two ligaments on the inside and outside, the collateral ligaments. And then there's also the meniscus tears that happen a lot of times. All these things, a majority of the time for the average person, is due to wear and tear because of poor alignment or poor posture of how they're actually allowing the knee to move. So we're going to do a little show and tell. Remember, we used to bring things into school, so bear with me for a minute. I'm going to show you. I'm going to bring in my Netter's Anatomy book here and kind of give you an idea of what the knee is. Now, we stripped all the muscle off the bone here, so you're just seeing it. So ligaments attach bone to bone. So here's the fib, here's the tib, right? And there's a ligament right on the outside that goes from the fib. It comes up and attaches to the femur, the upper leg. And that is the outside or the collateral ligament, also known as the fibular ligament, collateral ligament. It has its opposite on the inside of the knee, which attaches the fib up to the femur also. So that's the medial collateral. You have the ACL right here. Notice this makes an X, ACL and PCL. ACL is anterior, meaning front cruciate ligament, and posterior cruciate ligament. This surface right here is a condyle. It's an articulation surface, very smooth. And what they did was the patella would be right here normally. They took the patella off. We could use this kind of like as a guide as what a patella would look like. And the patella slides up and down as you bend your knee to keep it in a correct position. All right. So those are the ligaments. The ligaments, again, are bone to bone. So a lot of these injuries, these ACLs get torn. The meniscus, which is right under here, which are soft pads, get tears in them. And a lot of times we'll get these torn ligaments here on the side too. All of that is because the knee is designed to track straight in a straight line forward and back and up and down. It is not designed to twist. And it's the twisting that actually causes the biggest issues. So alignment is critical. Just like we always say, we're always going to talk about posture because posture and alignment is dynamic. So the way you allow that knee to move, it should always be straight. Or let's do it this way. There's roughly the knee. And the knee should always bend forward. The leg should bend forward and back. It should not buckle to the inside and twist or twist to the outside. That's where those tears actually come from. So this whole week we're going to be talking about how to make sure you're stretching your leg muscles so that you're not causing any aberrant pulling to the inside or to the outside. We're going to do some foam rolling to show you how to break up scar tissue and how to open the fascial system up. And we're going to also show you a couple rehabilitation exercises and actually how to do things like lunges and squats and walking upstairs and how to do them correctly so you keep your knee safe and strong. So if you have any kind of knee issues, definitely pay attention this week. If you got some friends that have them, make sure they watch. So share the videos with them this week. And again, if you have some specific knee issues you want to know about right away, leave a comment below so I can get right on them and we'll answer them this week. So we'll see you tomorrow and we'll head right into it. Take good care.